There's one image that I love to share with people when I'm talking about NorthStar and talking about really what drove how we approach this treatment. And that image actually comes from an article that was published by Dr. Nora Volkow, who's the head of NIDA, the National Institute of Drug Abuse. She took PET scans, which are basically images that are done by a CAT scan, but it not only reflects the imagery of the brain, it also shows you the activity of the brain. And it was really fascinating to note how quite active the brain is in a normal, healthy person. But in someone who has struggled with substance use, if they abruptly stopped substance use 10 days prior, the image that you see actually shows that there's very, very limited activity in the brain, most especially in the frontal lobes. The frontal lobes of the brain are where our executive function happens. This is where we learn, where we make decisions for the future, where we consider our past and anticipate what it is that we're going to need in the future. And so because of this, when people are struggling with substance use, their frontal lobes over time become less and less functional. And the behaviors that you see in terms of how people engage with people, the decisions that they make, that starts to demonstrate itself as a result of advanced substance use. Their brain function, their frontal lobe brain function is compromised. What we also noticed was that the speed with which that returns to normal is very slow. When you look at an image of a patient who stopped 100 days prior, there's still very diminished activity. That activity is maybe 10, 15% of normal, even 100 days out. So it occurred to us that if we don't do something to expedite and support a return to healthy brain function, patients aren't going to have the best outcomes because they can't make the best decisions. They're also being put today into an inpatient facility where they're being taught life skills. But if your frontal lobes aren't working, your ability and capacity to learn is impaired. So their ability to get a lot of educational benefit from participating in the group work that they do inpatient is often quite compromised, and often why it is that they come out and have not really been able to learn things that will help them be successful in their abstinence down the road.